Utah researchers developing a new way to detect COVID-19.
Our tech reporter Jordan Hogan joins us live this morning with more on how this all works. Good morning, Jordan.
John and Amy, imagine being able to detect coronavirus with a smartphone. Well, that's exactly what they're trying to do at the University of Utah. They're taking something they worked on before and reworking it for COVID-19.
What started as a device to help detect a completely different virus could become a big part of tracking COVID-19.
We started this project about 12 months ago, and the main idea was to enable people to have their own personal sensors to detect Zika in places that they travel.
Masoud Tabib-Azar is the lead engineer working on this project. The plan is to take the Zika virus sensor and program it to identify COVID-19 instead.
Our prototype is going to be on the order of the size of a quarter, and it would be communicating with a cell phone using the Bluetooth link.
If someone were to breathe, cough, sneeze, or blow on the sensor, it would be able to tell if someone had COVID-19. The results would then be displayed on a cell phone within 60 seconds. It could also test for the virus on a surface by using a swab and placing it onto the sensor. Tabib-Azar says he wants to make it possible to send the results to health agencies too.
You push the button, it can send to a central location, Center for Disease Control, or any other authority that you select in your options, and then in real time can update the map.
The sensor will be reusable because it can destroy the previous sample with a small electrical current.
In principle, you can put these devices in everybody's hand, and once we produce them in large scale, inexpensively, then it's like any other thing that people want to have with them.
The plan is to have a working prototype in 2 months before submitting it for clinical trials. That's expected to last another month, so hopefully in 3 months' time, this will be something any of us can use.
So the hope is that we can actually use this and make it so it's easier to test people than the current method with those nasopharyngeal swabs that go up your nose. So hopefully this is done sooner rather than later, Amy and John, so that we're not worrying about the slight bit of pain that we may have to induce with that one.
It's interesting to see all these developments start coming through. You know, I think we'll have a whole new landscape in front of us before long.